Hello and welcome to Talking Pharmaceuticals, an interview series brought to you by Making Pharmaceuticals and Distributing Pharmaceuticals. I'm Victoria Emerton, Conference Director for the events, which next take place in April 2025. And in the lead up, I'll be joined by experts from UK Pharma to share insights, opinions and practical advice, providing a fresh perspective on key challenges and opportunities in the industry and to look ahead to their involvement in the events. I'm delighted to be joined today by John Preston, Regulatory and Development Director of the Healthcare Distribution Association. John, thank you very much for your time in talking to me today.
Thank you, Victoria. It's a pleasure to speak to you today.
Excellent. So you're going to be busy at the event in April, in that you are both exhibiting and speaking in a presentation and in a panel at the event. But first of all, tell me about the HDA. What are the organisation's role and objectives?
Well, Victoria, the HDA is the trade association who represents the businesses who distribute medicines, medical devices and other products to community pharmacies, hospitals and dispensing doctors, and actually many other customers across the UK. Our members supply more than 95% of all of the medicines used by the NHS. They employ around 20,000 people and operate a safe, efficient and highly regulated supply chain for patients, the NHS and the wider healthcare sector. Our role as the HDA is to enhance the understanding of our often very underappreciated sector. Our sector distributes 40 million packs of medicines each week across the UK. It's resilient in the face of bad weather and many other challenges, the huge increases in volumes during COVID being a really good example. However, it's fair to say that often no one notices their medicines delivery until they don't turn up. So we look to bring our sector to life, making sure that the value it brings to patients, the NHS and the taxpayer is fully understood. We do that by engaging with politicians, policymakers, regulators and the wider pharmaceutical industry. For example, we recently hosted Karen Smith, the Government Minister for our sector, over the last couple of weeks we've hosted 2 MPs' visits to our members' premises. We have a fantastic collaborative relationship and meet regularly with officials from the Department of Health and Social Care and the MHRA, to name a few. In fact, we have trusted advisor status, meaning that they're able to discuss potential future policies and regulation with us before they reach the proper public domain. Our other main role is to provide a number of forums for members to network and share best practice. We have a regulatory group, a supply chain resilience group, a net zero group, and a supporting the NHS group. We also send out daily bulletins to keep our members up to speed with news in our sector. So I hope that gives you a broad overview of what we do as the HDA, Victoria.
Yeah, an absolutely crucial role, and anyone coming to the event that isn't aware of you, or I'm sure they should be, can come and have a chat with you. So what would you say are your members' priorities at the moment?
We are a small trade association, so we focus on 4 key areas. Those areas are regulation, supply resilience, net zero and supporting the changing NHS. So on regulation, it's our job to ensure that we and our members understand current regulations and work with the regulators to ensure that future regulation is fit for purpose and proportionate to the risk to patient. There's always loads going on in this space. We're currently looking at moving to paperless supply chain, working to improve controlled drug licensing. There are changes to medical device regulations coming, and pharmacy hub and spoke, just to name a few. And of course, there's still some Windsor framework things going on, and we need to keep a real close eye on those as those continue to develop. However, one of our biggest regulatory topics for us right now is working with the MHRA to redefine the relationship between regulator and regulated. We'd like to see a trusted partnership model, seeing less inspections but more information and data sharing. There's such a long way to go with this one, but it's a real step change in the way that our sector might be regulated. On supply resilience, we're part of cross-industry and government efforts to improve the continuity of supply to medicines in the UK and ensure that the sector as a whole has a viable future. The recent changes to national insurance and national living wage, for example, have really affected our members, and we need to understand what change that's going to have in the future. Our members are making great strides on net zero and sustainability as a whole, whether trialling using electric vehicles, adding solar panels to warehouse roofs, or working to better support the local communities, but they really need help. Wholesaling is a high volume, low margin industry, meaning that government help will be needed to fund the huge investments needed to get to that next step, particularly given the challenges with rising taxation that I mentioned before. Our last work stream is supporting a changing NHS. We worked closely at the new government plan and contributed to the discussions on the 10-year plan. Any change to the NHS is, of course, likely to change the way that medicines are delivered. So we need to be aware of that on top of it and thinking how that change might affect our members and the customers that they serve.
We're very excited to have HDA and MHRA under one roof in Coventry, actually in April. So you can answer questions together. Indeed, you're sitting on a panel with the MHRA. So anyone who's got questions on anything related to distribution and all those challenges that you've just mentioned can come along and ask those in a live setting. So what are the future challenges to the pharmaceutical distribution sector?
Oh, Victoria, where do you actually start with that one? Our industry is in perpetual change. As we respond to the changing needs of customers, regulators and governments, actually that constant change is a challenge in itself, but it's one that our industry continues to rise to. But it is important to understand that as a changing industry, everything moves every single day. Pharmacy funding is a real issue in England, and as our biggest customers, it's a real issue for us as well. Pharmacies are finding it tough and more are struggling to pay their bills. Generic prices at the lowest they've ever been in years with no sign of recovery. And in the face of increasing costs, this is becoming a real challenge for wholesalers to manage their margins and make sure that they're profitable. On a global scale, responding to, but not just preventing climate change, as temperatures get hot and hotter, will need to be thought through carefully too. As we see hotter temperatures in the UK, we have to think carefully what difference that means to the equipment and the other things that we have to do to prevent and to protect our stock as things move forward. Geopolitics is a real pivotal place right now. Really important with global supply chains. What effect will the EU's work to reduce shortages in the EU have on the medicine supplies to the UK, for example? And of course, we all waited with bated breath to see what effect the Trump administration's proposed tariffs might have on the medicine supply. It might be good for us or it might be bad, but who quite knows at the minute?
Indeed, I think that's an ever-changing landscape, isn't it? And by April, things may be clearer. Who knows? You can certainly keep us up to date on that in 12 weeks' time. So you're talking at the event in the conference. Your presentation title is Current Focus of the Wholesale Distribution Sector. What will you be covering in your presentation?
A lot of what I'm going to cover is what we've talked about today, but in a lot more detail and granularity. We have a regulatory roadmap at the HDA that allows us to kind of foresee what's coming from a regulatory perspective. And I'll show that so we can see what's on the horizon and how we might react to those changes as they come. The other thing I'd say that I'm speaking on the panel, and I'm really looking forward to taking questions from the floor. I actually think some of the most interesting discussions come as a result of the questions that people ask in these situations, because of course it's real people working in the real world that are asking questions and want to know how changes in regulation, changes in economics might affect them more personally. So I'm really looking forward to the whole event, and I say, both the panel and the presentation.
Indeed, and that's the power of events, isn't it? And getting face to face. It's learning from each other. It's information exchange. You'll learn from the questions that you're asked, what people are finding challenging, and they'll learn from you and your responses how they can handle some things that they're dealing with in their businesses. So I think panel discussions are really, really powerful things to hold, and delighted to have you involved in one. So just to recap, John's presentation title is Current Focus of the Wholesale Distribution Sector, and he will also be taking part in a panel with AIT Worldwide, Transbridge Freight Services and the MHRA, so a perspective from both sides of things, both the regulator and folk actually out there delivering medicines. The HDA will be exhibiting on stand 116. So I imagine while you're off distributing your wisdom in the conference, there'll be people on your stand for both days of the show that anyone can come along and have a talk to you and your colleagues about the HDA, how you can help them, and what they're finding challenging in their workplace.
There's certainly will, Victoria, and we look forward to meeting as many of our colleagues. Certainly, we had a great number of people visit us in the last couple of years when we've attended, so we really look forward to that.
Fantastic. So just to remind everybody watching this that attendance at the exhibition and the conference is free. Registration is open at www.makingpharma.com. The conference programme is live. And we look forward to seeing you, John, your colleagues and everybody watching this at the Coventry Building Society Arena on the 29th and 30th of April. Thank you very much for your time today.